Okay, evening everyone. I'm Hannah. I'm a press officer at the Science Media Centre. I'm really sorry that I couldn't be at the event this evening, but thank you so much to Tom for inviting the SMC along. And I've recorded a sort of 15-minute presentation about the work of the Science Media Centre, or the SMC as we're generally known, and about the work that we did in the COVID-19 pandemic. So hopefully that'll be of interest. So yes, I'm just going to try and share my screens and put that into, there we go. So I'm just going to quickly go through the work that the Science Media Centre does, a bit of background, and then what we've done over COVID. So this is just some background here. We were set up in 2002 after a period of time where things were going very wrong with science in the media. So this was the time of MMR and autism, or just after, GM crops, BSE and mad cow disease. Animal research was very controversial, and basically what all of these sort of very different scientific areas had in common was that in the media there were very few science voices, and they were getting quite misrepresented. There were plenty of campaigners, plenty of politicians, but very few scientists getting their points across. There was a House of Lords Science and Technology Committee, which looked into what went wrong with science in the media during this time, and the Science Media Centre was set up on their recommendation. So our philosophy, which is the basis of all that we do, is that the media will do science better when scientists do the media better, meaning that the best way to improve science reporting in the press is for scientists to enter the fray themselves and to get involved with the media. And so all of the things we do are set up under that sort of principle. We're an independent press office for science. We run as a charity, and we're funded by over 120 science organisations, including universities, journals, UKRI, research charities and industry. But we maintain complete independence from each of our funders. We're in the very privileged position that we don't need to worry about getting our name in the press at all. All we care about is ensuring that scientists' voices are heard on the messy, controversial or scary science topics when they're covered in the media. So this slide is just about our database, and this is the real lifeblood of the SMC, and it holds all of the contacts that we work with. So we've got over 2,000 scientists on our database. That's probably gone up because of COVID. And these are experts who work for respected institutions, who publish in peer-reviewed journals and have a track record of quality research in their specialist field. And they've given us permission to contact them about topics in the media relating to their research areas. And I'll go through some of the activities that we do with them in a moment. We also work very closely with press officers across the UK, sort of scientific organisations, and of course also with the UK national science, health and environment journalists. And we're very lucky in the UK that we do still have specialist journalists who focus on science, and I think that's really shown how important that is during COVID. So what do we actually do on a day-to-day basis? We've got three main strategies that we call rapid reactions, roundups and media briefings. And I'll go through some of these in a moment with some COVID examples. So this is just to show you our output and how it's changed over the past sort of year and a half. This chart here, the blue bar is the 3-year average of our output in terms of roundups and rapid reactions, and the purple is the past sort of 18 months or so. So that's the dark purple is just what we've done on COVID, and the lighter purple is the non-COVID stuff. So you can sort of see that in early 2020 our output just shot up. It hasn't quite reached that level again, but it kind of followed the COVID case graphs in a way. You could say we sort of joke that when COVID gets busy, the SMC also gets busy at the moment. So that just shows you how our output's changed. And now I'm going to take you through what rapid reactions and roundups actually are. So rapid reactions are kind of what they say on the tin. We are constantly monitoring the news outlets for breaking news. And if we think a story could benefit from the involvement of scientists, then we'll contact them, and we're really looking for quick responses to this breaking news story. So I'm going to take you right back to the beginning. And this is the first rapid reaction that we did to COVID. And this was when the news of a novel coronavirus outbreak was sort of entering the UK media. And so, yeah, we went to our experts, our infectious disease experts, and we asked them for comments. And you can see we got some from Jeremy Farrer, who's the director of Wellcome. And even in this early stage, he was kind of, concerned and was talking about person-to-person transmission and about how asymptomatic and mild symptoms might be sort of hiding how many people are actually infected. And then quite insightfully, his last words were, "There is more to come from this epidemic," which we now know all too well was very true. So I can't leave these up too long because I'm a little short on time, but here's just another example to show you. So Natalie McDermott here, talking about airport screening and the sort of limitations with that, and then also sort of speculating a little bit about how the coronavirus might be spread. And with these comments, there is always going to be a little bit of speculation, and often the scientists are very open about what they can and cannot say at this time, or what they cannot know for sure. But we very much believe that there is going to be people speculating, and if we don't have intelligent scientists who are the experts in that area, then that speculation is going to be left to people who aren't as well qualified for it, and journalists will just go and get their quotes from elsewhere. So yes, with this roundup, we've got loads more comments from other experts as well, and you can see all of these on our website if you want to go back and have a read of them. And then we send these comments out to the journalists on our lists, and they can use them to inform their stories as the story evolves. You can see plenty of our comments used here, and then also picked up by the BBC as well, and there were lots of others, but I won't show you them all. So this is just to say what we got rapid reactions on throughout the pandemic. So all the weekly stats that came out, we'd ask our experts to weigh in and sort of talk about how that changed from the week before and what it means. Any big government announcements, we'd get the experts' views on. Stuff like new drugs, new vaccines, the SAGE evidence, just basically any time there was a big break in COVID news, we would ask our scientists to weigh in. Roundups, so these are very similar in that they're expert comments, but they are in response to a new piece of scientific research. So we get the press releases from the top journals, from the universities and funders, etc. So when there's a new piece of research, that press release will go to the journalists and will go to us, whether that's a few days before it's published under embargo or if it's immediate release. And we'll look out for stories that we think could be sensationalized or misreported, and we'll ask for third-party comments to provide context and guide journalists if we think that's the case. And at the beginning of COVID, any of the research around COVID, journalists were really keen to hear what other scientists thought, because it was such a new evolving area. And sometimes the study could be really good quality and really important, and the comments that we get from third-party scientists reflect that, and the journalists will sort of have more confidence this is great science and feel happy going big with it, putting it on the front page, whatever. And sometimes the comments might say this study is really good quality, but it's early stages, it's in mice, it's got a small sample size. So we need to be cautious about interpretation in terms of sort of real world meaning and what we can conclude from this. And sometimes the study is really flawed and is potentially overclaiming, and comments are really useful to emphasize this and to point out where the main body of evidence lies. And the example that I'm going to show you is a study from summer last year, and this was a study which looked at COVID-19 infections in Italy, Wuhan and New York before and after the implementation of mandatory face mask use. And it suggested that face masks played a large role in reducing infections. And at this time, as they have been since, really, face masks were very sort of controversial. The UK government was kind of trying to decide whether or not to recommend them, to make them mandatory. And a lot of our scientists were very sort of pro face masks, I guess you could say. But this study was very flawed. So this is just the press release. This is what we saw. We thought, OK, this looks interesting and topical, and we think our experts will want to say something. So we sent it out to them, and I'll show you a couple of examples. So this is one from Paul Hunter, and you can see he was very suspicious of this study, and yeah, pointed out a lot of limitations, a lot of reasons why he says his paper does not provide any convincing evidence or analysis. And sorry, I'm afraid I can't leave that up there for too long, but just to give you an idea that he really wasn't happy. And then his thoughts were echoed by other experts as well, who all pointed out major methodological flaws. And yeah, I quite like this from Dr. Ed Hill, who I think believes in the use of face masks. As he says, face masks may be an effective tool for reducing transmission, but this study does not produce robust evidence to support that. So this is just a nice example of even when scientists might believe that something is the case, it's still important to highlight if a particular study is weak and not to sort of just use that to support what they think is right, even if the study itself is not very good. We sent these out to the journalists, and we actually saw no coverage of the study in the national news media, which from our point of view is a great result. And we like to think that if we didn't have all these comments from scientists sort of saying this study was really poor quality, then the journalists might have gone quite big with this, seeing these face masks were very controversial at that time. But yeah, we like to think that journalists take into account what the scientists say, and there was all these comments saying this is not very good, so they decided this wasn't the one to put in their papers. And finally, media briefings. So this is when scientists come into our office, or in the old days, they'd come into our office and we'd have a big old school news briefing with the journalists asking lots of questions, and it gives the scientists more control in the way that a story comes out, and they can really explain complex science in detail with all the nuances and caveats. There's two types of briefings that we generally do. News briefings, when there's a new piece of research, so we'll get the authors to come in and explain their findings and answer any questions. And then background briefings, where there's no new science as such, but there's a topic which keeps coming up, and the scientists in the area feel that journalists could do with a bit of a refresher and a reminder of, sort of where the main body of evidence lies. So again, taking you back to the start, this was what we call an emergency background briefing. So this is when these scientists hadn't done any research themselves, although I think Neil Ferguson was doing some modelling. But this is a huge area of breaking news, and the journalists are really clamouring for more information. So we got together 4 sort of top infectious disease experts to just talk about what we currently know and what sort of needs to be done and what we might expect in the future. So Neil Ferguson, Peter Horby, Josie Golding and David Heyman all came into the S&C, and these were the journalists that attended. So that's quite a big number for us back when we were doing in-person briefings, and they were all from the UK nationals. And this is a picture of everyone sort of crammed in before social distancing, I should say, back in January 2020. They were really, really interested in what the scientists had to say. And so this was some of the headlines that came out of that briefing or around that time, and you can see quite a lot of them were quite sort of scary, but I think this did reflect what the scientists said, which was they were concerned and they were worried about what might come with this epidemic that seemed to be taking off in Wuhan. And yeah, the journalists could use quotes from the briefing to better inform their articles. And as the story grew, information that journalists gained at that briefing could also be used in future stories. So over the days, we saw the same quotes used in other stories to sort of make sure that the background was right there. And of course, the scientists were also used in broadcast interviews to give their insights to the story. So this is a more recent news briefing. This was in August 2020, so we were all working from home by then, and everything had to be on Zoom. And this was a news briefing, so a new piece of science. This is from the ISARIC team, who are a big consortium of clinicians and clinical researchers. And they were really great throughout the pandemic and still are in terms of looking at data coming out of hospitals. And this is one of their papers specifically looking at children who were hospitalised with COVID-19. So this was the invites, and we had Olivia Swan and Callum Semple on the panel. And this is just, on Zoom, but the journalists very quickly adapted, as did the scientists and as did we. And I think probably we won't be going back to in-person briefings in the same way because Zoom just worked really well. These were the journalists, a slightly smaller bunch, which is probably to do with it being in August. And then this was the coverage, which was absolutely glorious. And yeah, just some really, really nice straight coverage from a briefing which was very sort of reassuring really about the risk for kids. So this was the first big study looking at the risk to kids in terms of hospitalisation. And yeah, quotes, of course, were also used throughout the coverage, as you can see here. And there was some really, really nice coverage with a lot of use of quotes from the briefing. And yes, we held press briefings throughout the pandemic on loads of different pieces of research. So the recovery trial, we worked with the Oxford vaccine team. We've done stuff on long COVID, on immunity. So yeah, basically any big piece of research that came out, particularly in the early days, we were really keen that the scientists got to talk to the journalists themselves, and kind of the political journalists had their go at the press briefings with Boris and Chris Whitty and Patrick Vallance, but we really tried to make sure that the science and health journalists got their bit as well through these briefings. So yeah, that's a very quick run through of the work of the SMC during COVID. And again, I'm sorry that I can't be there in person, but I hope you all have a really nice evening. And yes, you can follow us on Twitter or go on the website to find out more. Okay, thank you very much.